नमस्कार। आज हम जानेंगे डॉक्टर जतिन सरीन से बड़ी आंतड़ियों के कैंसर कोलोरेक्टल कैंसर के बारे में।
Good evening, and thanks for inviting me for this important deliberation. Colorectal cancer, एक आम भाषा में जिसको बड़ी आंत का कैंसर भी कहते हैं, is actually was considered to be a disease of Western or developed world. It is a very common cancer out there, but sadly, since we have adopted to their kind of lifestyle, their kind of eating habits, their kind of overall living standards, colorectal cancer is gradually increasing to alarming extent in our country, and there are some regions who are which are afflicted badly with this particular cancer.
सर कोई ऐसा पर्टिकुलर एज ग्रुप है which is more at risk for colorectal cancer or any particular places in the country जहाँ पर ये चीज़ ज़्यादा बढ़ रही हो?
Yeah. See, ideally, the colorectal cancer is known to increase in incidence with the age. As the age increase beyond 50 years, the incidence of colorectal cancer increase. Sadly, in our country, this age limit is gradually decreasing. I would say in our country, you should be, there are many patients, I have in fact many patients who are even younger than 35 or 40 years of age. So
बड़ी आंतड़ियां हमारे शरीर में क्या काम करती हैं?
then the large bowel जो हमारा है, जिसको हम large intestine भी कहते हैं. Large intestine is a place where formation of feces or excreta occur when the excess water from the waste food which is processed in this large intestine, it is absorbed and finally turned into stools. I have seen some people who are getting treated for piles, which is a very common disease, and they don't get themselves scopy or endoscopy done for the fear कि पता नहीं कैसा procedure and all this stuff.
क्या कारण है कि कोलोरेक्टल कैंसर एडवांस्ड स्टेज में जाकर डिटेक्ट होता है?
I have seen people harboring colorectal cancer and they have been treated for piles. A very sad state of affairs that way, just because of their you see hesitation, or just because of their unwillingness to get a proper checkup done. The cancer which could have been diagnosed early is usually diagnosed when the things go beyond the normal surgery and all. So that is the important thing. So at least stool occult blood is a very simple test. It's a simple stool test that can be done.
What are the risk factors for colorectal cancer?
There are certain families in which there is a genetic risk of developing colorectal cancers. They are called there are various syndromes in colorectal cancers, like familial adenomatous polyposis, HNPCC, or Lynch syndrome. There are various hereditary syndromes which are not so uncommon, and these families need to be really alert about colorectal cancer. Cholangitis, or have a cholecystectomy, that is removal of gallbladder done. Even they have just because they developed gallstones because of excess fatty diet and all, which is very common, especially in the North India and Gangetic Plain. You know, our dietary this thing is lot of oily food and fatty food is being consumed. So gallstones are very common, And cholecystectomy or a removal of gallbladder is actually protective for one of the dangerous cancer, that is gallbladder cancer. True, but it has been seen, there has been a circumstantial evidence that people who get their gallbladders removed, they have slightly higher risk of getting colorectal cancer.
डाइट किस तरह से कोलोरेक्टल कैंसर होने की संभावना को बढ़ाती है?
The other important modifier factor, and which is most important, is the change in the diet. People usually consume these days high fat, low fiber diet, and because with the advent of even junk food, the kids itself are being exposed to lot of high fat, low fiber diet, which leads to deranged bowel habits, constipations, and all this stuff. And this is a very, very important and very much modifiable risk factor that we can adopt. Especially the diet containing red meats. There are people who do consume red meats, and that is consumed in a pretty good amount in certain families, especially in some places. Red meat form a staple part of diet of many people. So in those cases, yes, the risk of colorectal cancer is high, very high. Sedentary lifestyle is another thing which is a modifiable risk factor, and control of sugar, control of diabetes is another thing what one can do to alter their risk of this thing. So these are various factors which one can take charge on their own, and people keep on lingering on their symptoms, taking on over the counter medications, and they don't consult or get themselves tested properly, and they become complacent. And this is a common problem I have seen with, why these colorectal cancers are coming up in advanced stages in India, is people don't, especially the younger generation, feels that they won't get cancer. Cancer is a disease of elderly. Well, sadly, I have a lot of patients who are even less than 35 years of age. So the things are not so good if we don't improve our eating habits.
Dr. Jatin, what's the simplest way to detect colorectal cancer?
In stools, a very simple stool test, and colonoscopy, or what we call endoscopy of your large intestine, that is done every 1 to 3 years after the age of 50, and this is a norm. It is actually not quite practical in our country, and that is why the people have to be aware themselves, and get themselves checked as and when
They feel the symptoms. Okay.